I'm going to go ahead and get started since it is noon. Welcome to our first webinar of the Plant Powered Challenge. I'm really excited to be here with you all today. My name is Kara Tibby, and I have the pleasure and privilege of managing the lifestyle medicine practice. Myself and my husband and two young children have been plant-based for about 5 years now, and that all started actually from the Plant Powered Challenge in 2017, which got me excited about plant-based nutrition and ultimately changed the way that we have been eating ever since. And I'm so excited for you all to listen to the rest of our webinars. You will get emailed at the beginning of the week with the schedule that's going on. You can check our Facebook page as well. And today I'm super excited to welcome you to our very first session with Dr. Christy Artz. Dr. Artz is the medical director of lifestyle medicine. She's the lead physician for the culinary medicine program and plant-based eater for many years. She's a member of the American College of Lifestyle Medicine Board of Directors, certified specialist in lifestyle medicine by the American Board of Lifestyle Medicine, and a board certified emergency medicine physician. Dr. Artz's mission is to reduce chronic disease at a population level and assist individuals in achieving their best health. So welcome, Dr. Artz, and just so everybody knows, please ask questions in the Q&A section, and our moderators will be answering that throughout. And also we will have a short Q&A session at the end as well. So without further ado, Dr. Artz, take it away.
Thank you, Kara, and great to have all of you joining with us today. We're really excited, as Kara mentioned. This is our, I think, 4th time hosting the Plant Powered Challenge. We had a couple-year break, and we're very excited to be at it again. This is going to be a very exciting 4 weeks, and again, just so happy that you've all decided to join us. And before I get started, I also want to extend a heartfelt thank you to the Lifestyle Medicine team, who has just poured all kinds of energy and enthusiasm to bring together the 4-week Plant Powered Challenge. So we hope it's a great experience for you, that you learn a lot, that you experience positive changes in your health. I'd also like to start by just providing a quick disclaimer too, that what you'll receive in terms of information is not meant to be medical advice. So of course, make sure you're talking to your medical provider if you're making changes that could have hopefully a positive impact on your health. And with that, we're just thrilled again that over 2,000 of you have decided that 2024 is the year that you're going to take a look at your nutrition and think about proactive steps that you can take to increase the plant power in your nutrition. And hopefully today is the first day of a very successful journey that you'll begin taking to improve your health, the health of your family potentially, as well as even the health of the planet. So every change that you make in a positive direction will have a positive impact on one or more of those areas. And over the next 4 weeks, we really hope to inspire you and to empower you with tips, maybe things that we've learned along the way. We've all implemented plant-powered nutrition into our daily lives, and just some of the science also that might make an impact in terms of why you might think about making changes in your own life. So what you get out of this challenge really depends on what you decide to put into it. So the more changes that you make, the more health improvement you might also experience. So keep that in mind, and also give yourself the grace and the time to make changes that are meaningful to you and your family. And with that, everybody likes a New Year's top 10 list. And so I'd like to start our Plant Powered Challenge by giving you my top 10 reasons for taking the Plant Powered Challenge. Of course, you may have additional reasons of your own, and please drop those in the chat. If I've missed something and something that's inspired you to take this challenge, we'd love to hear what that is. So reason number one, this is, I would say, one of the biggest ones that I think about as a medical doctor. Why is plant-powered nutrition so important? And I'm going to start with a few pretty sobering statistics in terms of chronic disease. Currently, there's over 100 million US adults that have either prediabetes or type 2 diabetes. Heart disease and stroke remain the leading causes of death in the US. And currently, over 80% of the $4.5 trillion spent on healthcare is directed toward the treatment of chronic disease. So, in sum total, this is a really extensive problem. It's something that might be affecting you as an individual, or maybe you know someone, a friend or a family member who has one of these chronic conditions that's greatly impacted by the quality of our diet. And what we know from the science is that poor diet quality is the single greatest risk for death and disability related to chronic disease. The standard American diet, or the SAD, if you've heard that term before, so SAD stands for Standard American Diet. That's one of the primary drivers of chronic diseases of all kinds. And the reason that that happens is that standard American diet really drives a lot of chronic inflammation. That is oftentimes one of the key underlying factors to developing many of these different chronic metabolic diseases. And it's also the most common cause of progression of many of these chronic diseases as well. So, the eating pattern that we adopt, and if we start to make changes from that standard American diet to a more plant powered diet, we can actually see very significant improvement in some of these chronic conditions. And I'll give you one small fact to consider. Even if you change just 3% of the intake of your overall protein, so if you shift from animal protein, shift and adopt 3% of just plant proteins in your diet, you'll see a reduced risk for all cause mortality related to these chronic conditions. And what do we mean by plant powered proteins? And you'll learn more about this over the coming weeks. These are going to be things like whole grains, beans, which are legumes, beans, chickpeas, and lentils, and lots of other delicious foods that you'll be thinking about including over the Plant Powered Challenge weeks. So, reason number two, reset your palate to the taste of real food, these whole plant foods. So, whole and minimally processed vegetables, fruits, whole grains, and legumes, not only are they excellent for our health, but they also happen to taste great. Studies have demonstrated that even just a couple short weeks of eliminating added salt, added sugar, added oils to the diet can allow our palate to reset. And we see this all the time in patients that we see and treat in our lifestyle medicine practice. If you give your palate that break, you can really acclimate it to the taste of these whole foods and these whole plant foods in particular. Also, think that cultural diets around the world oftentimes incorporate many of the same types of foods. Again, it's going to be foundational to have whole grains, legumes, vegetables, fruits, herbs, and spices. These are key pillars of nutrition in all cultures throughout the world, and we can reacclimate our palate to these whole plant foods. So if you're even trying to break a sugar habit or maybe too much salt in your diet, we commend you. This is a really important step to be taking to reclaim your health, but give yourself some time and also know that it can happen fairly quickly if you make those changes. So we'll go on to reason number three. So this might be a big one for many of you. It's a New Year's resolution time right now, and many of us are looking to achieve and maintain a healthy weight. And plant-powered nutrition can really help us on that journey to achieving that health outcome. So current statistics report that 2 out of 3 US adults are living with overweight and obesity, and many individuals are looking for sustainable ways to achieve and maintain a healthy weight. What you see here is the concept of calorie density. And it's a very simple but very powerful concept, and one that as you begin to apply it to your own life, you can really simplify the approach to healthy and delicious eating. So, calorie density is typically defined as the amount of calories per weight of food. So, that might be expressed in calories per pound of food. A lot of studies on calorie density demonstrate that most individuals, on average, eat about the same volume or quantity of food. So, as you begin to shift into less calorie dense foods, which happen to be our whole plant foods. So, again, our vegetables, our fruits, our whole grains, our legumes, our nuts and seeds, which are a little bit more calorie dense, but they're packed full of nutrition. So think about that as you're approaching your you're making your steps toward achieving and maintaining a healthy weight for 2024, is that this calorie density concept is really, it goes hand in hand with whole plant food nutrition and can help you to achieve this goal. So reason number three is to increase your health span. I'd like to first start with a definition of what health span even means. So it's typically just defined as the expected amount of time that you will experience where you're living with good health, not experiencing disease, not being affected by chronic conditions or disabilities related to those chronic illnesses. So we want to have both a longer lifespan, but more importantly, a longer health span where we're vital and we're active and we're able to do all the things that we love to do. Like you see in this picture, line dancing into the later decades of our life. And what we do know from the science is that only about 20% of how long we live is determined by our genes, whereas 80% of how long we live is actually impacted by our lifestyle habits, and most prominently by what we decide to include in our diet on a regular basis. One great example that we can turn to are those blue zones. So, areas around the world where we have the longest lived individuals, the highest percentage of these longest lived individuals who are living free of disease. And many of these individuals follow a whole plant food nutrition pattern. And what we see on the flip side in the US is that there's oftentimes quite a significant gap between health span and lifespan. So even if we happen to live a long life, oftentimes we spend the last 10 or so years of our life living with chronic diseases that cause disability, and also can be quite costly. So we want to increase our health span, and one way that we can work towards that is adopting this plant-rich dietary pattern. So reason number five, let's turn to our gut health and showing our gut some love. Gut health has gotten quite a bit of attention in the media of late, and we can understand why. There's a few key reasons why gut health is so incredibly important. Number one, 70% of your immune system actually resides in and around your gut. Number two, many of the chemicals that regulate or modulate our mood are actually produced in the gut by our gut microbes. And number three, our metabolism and even important regulators of body weight are also greatly impacted by the health of our gut. And what do we need to really enhance and improve our gut health is a lot of the prebiotic fibers that we find in our whole plant foods. So plants happen to be rich in disease-fighting fiber and phytonutrients that really help to protect the lining of our gut, which is going to help protect our immune system and keep us from developing things like autoimmune conditions, for example, and can even influence how sick or if we become sick with cold and flu viruses, which we all know are rampant this time of the year. So start today by maximizing some of these immune regulating and gut enhancing whole plant foods that are going to help your health flourish. Eat both raw and cooked vegetables. Include anti-inflammatory spices like cinnamon and turmeric and cloves and garlic. They taste great, but they also help to really improve our gut health overall. And lastly, one other tip you might think about remembering in terms of gut health, and you'll probably hear more about this in the coming weeks from one of our registered dietitians. Think about tracking intake of your whole plant foods and try to achieve about 30 different types of whole plant foods in your diet each week. That plant food diversity will enhance your gut health and make you feel better overall. So, reason number 6 is this idea of supporting the health of our planet, or what we would call planetary health. A plant forward diet is what the Eat Lancet Commission, or a commissioned body that looked at the impact of diet on the health of our planet, and they call it a win-win diet. So it's healthy both for you as an individual, but it also happens to be healthy for the planet. And among 80 different solutions for slowing climate change, plant-based diets have ranked number 4 in terms of their impact in reducing greenhouse gas emissions. Even as you move toward a more plant-rich dietary pattern, you can reduce your individual impact and greenhouse gas emission footprint, if you will, by nearly 30% by eating a very plant-rich or plant-based dietary pattern. We have other schools of thought, one called the Menus of Change, that looks at healthy, sustainable dietary patterns. And what they recommend is, number 1, to think produce first. So again, there's that plant-powered nutrition. Make whole intact grains the new norm. So more of our whole grains that of course are one of our plant-powered foods, and move legumes and nuts to the center of the plate. So think about our plant proteins again as an excellent source of protein and something to begin to shift into more into your regular diet. So with climate change creating concern for many of us, adopting a plant-rich dietary pattern can be one specific actionable step that you can feel really good about in 2024. On to reason number 7. This is another big one that I think about quite a bit. As we all know, medication costs can be quite high, and it's really challenging if for someone who is being prescribed a lot of medications for chronic conditions. Of course, medications can be incredibly important and necessary, but as we adopt a more plant-rich dietary pattern, what we often see is a reduced risk for chronic diseases of all types. Those would be things like hypertension, type 2 diabetes, cardiovascular disease, and even certain types of cancers. So adopting a whole food plant-based diet frequently results in needing fewer medications. This is oftentimes expected. Our body is under less inflammation, and then thereby oftentimes we need fewer medications or less amount of medications that were prescribed in order to better manage these conditions. And I'll give you another example, a well-studied plant-rich dietary pattern called the DASH diet. It stands for Dietary Approach to Stop Hypertension, has demonstrated a reduction in blood pressure by about 10 millimeters of mercury, which is about what you see, or even more than many of the impact that many of our medications for blood pressure or hypertension can provide. So adopting that plant-rich DASH dietary pattern can actually help you achieve the results or better that you might see with taking a medication. Increasingly also, studies are demonstrating the power of whole plant food nutrition to achieve remission of type 2 diabetes. Now, this is particularly exciting given the vast number of folks who are currently being treated for type 2 diabetes. So adopting a high quality whole food plant-rich dietary pattern might, and I would advise to do this under the care of a trained medical professional, but this might allow you to achieve remission of type 2 diabetes and not need as many or fewer medications for that condition. And again, given the cost of medications, reducing need for medications is increasingly important to achieve personal and optimal financial health as well. Let's get to reason number 8. Since we're on this sort of financial side of why it can be really helpful to adopt more plant-powered nutrition, think about the impact of our groceries on our monthly um, financial needs. So highly processed foods and meat products are oftentimes some of the most costly products or food products that we purchase at the grocery store. On the other hand, consuming a plant-forward diet can actually allow us to achieve considerable savings. Now, there was a report in 2017 that showed that buying fruits and vegetables is cheaper than buying processed foods, and of course, some of those ready-made meals and takeout foods. So the equivalent of, for example, one fast food hamburger can oftentimes buy us large quantities of whole plant foods. For example, a pound of sweet potatoes, or a pound of apples, or even a pound and a half of carrots. So lots of different dishes that we can make with these whole plant foods. And we want to also think about the impact that that has down the road for our financial health, in terms of reducing our risk for developing chronic conditions that are also costly. Produce is often cheapest also if you are eating seasonally. Now, of course, this time of the year is quite challenging. We're in the middle of winter in Michigan, so there isn't a whole lot available now. But otherwise, during the course of the year, a lot of our local produce, bought at farmers markets even, can be very cost appropriate, and our frozen fruits and vegetables are always a great option as well. So think about plant-powered nutrition as you're doing your next grocery list, and all the great ways that can lower your grocery bill. Experience better flavor is reason number 9. Now, we've talked a little bit about herbs and spices already, and one of the most exciting things, not only are spices and herbs delicious and great options to include in your food, but gram for gram, herbs and spices have more anti-inflammatory effects than almost any of our brightly colored foods. For example, like berries. We all know blueberries can be so health promoting, but things like cinnamon and oregano and some of our other herbs and spices have very significant impact to reduce inflammation throughout the body. So not only are they disease fighting, but they also happen to be incredibly delicious. They're also incredibly versatile. So we talked briefly earlier about those cultural dietary patterns around the world, oftentimes using very, very similar types of foods like vegetables and legumes and whole grains, but using some of those herbs and spices to really give cultural cuisines their different flair and unique flavors. So if you're not currently using herbs and spices right now, I'd recommend start slowly. You don't need to have every herb and spice in your pantry right now, but start with a couple and start using them on a more regular basis. Try some simple homemade taco seasoning blends instead of buying taco seasoning at the store that oftentimes is packed with lots of added salt and preservatives. Make a simple taco seasoning with cumin and coriander and chili powder. Add some parsley to your soup or salad. Maybe even sprinkle some chopped cilantro onto your tacos. And then think about making some homemade salad dressings with a simple vinegar, a little bit of olive oil, and some herbs and spices. And we have lots of great recipes. I think a few that were sent to you today, and you'll oftentimes see herbs and spices being highlighted and a lot less added salt and added sugar to these recipes. Also think about taking some cooking classes. Our chefs can really help you learn more about how to include these delicious and disease-fighting herbs and spices to many of your meals. And finally, reason number 10 is to really think about how we can benefit from changing in community, in lifestyle medicine, and when we begin to make changes in our diet, it's so much easier if we try to do this with other individuals. So maybe it's someone in your household, someone in your family, maybe it's a colleague that you're looking to make changes and challenge each other. Use this community of 2,000 plus plant powered participants to really inspire you to make these changes together and have a healthier, happier 2024. And I have one final reason to think about all the great reasons to be healthy and happy in 2024. And I want to wish our University of Michigan Wolverines best of luck today in the national championship. And with that, thanks so much for listening to the top 10 reasons. We'd love to take some quick questions or comments from all of you in the audience.
Thank you so much, Dr. Artz. That was a wonderful presentation. We do have a couple of questions. The first one is around gut health. So an individual asked to please define gut when you say gut health.
Ooh, that's a good question. So when we're talking about gut health, we're of course talking about the gastrointestinal tract. So all the organs, our intestines, all of that's going to contribute to how we digest and metabolize food. But we're also thinking about the trillions of microbes. So these are the different bacteria, the viruses, all, lots of different microbes that live in the gut. And they oftentimes are meant to live in a very healthy way with our body. They're meant to be there, in other words. So the more that we eat these prebiotic, fiber-rich whole plant foods, the more we can improve the overall health of our gut. So that will be both how the gut functions, but also those trillions of microbes that live in the gut.
Thank you. All right, another great question says, hi there, are there any foods that help with the bones? Mostly around osteoporosis. So she has osteoporosis, and some others in her family do as well.
Yeah, so that's a great question. Bone health, of course, is another great reason to think about plant-powered nutrition. And oftentimes we think about bone health just being related to maybe calcium and vitamin D, which of course are going to be very important nutrients. But we also want to think about those vitamin K rich sources of food. And these are going to be things like leafy greens, other non-starchy green vegetables. We can also get great sources of calcium in some of our plant-based proteins like tofu, for example, minimally processed soy foods. Some of these are fortified with vitamin D as well. So sunlight exposure, vitamin K, as well as some of our plant proteins that can be a rich source of calcium as well are going to be important foods when we're considering our bone health. Oh, and lastly, I don't want to forget strength training and exercise, because that goes hand in hand with great plant-rich nutrition when we're trying to build great bone health.
Right, I think we probably have time for one or two more questions. So we had a question early on about protein powder. So do you have any recommendations on protein powder? I have heard women should stay away from too much soy, is what the question states.
Without going too far down kind of the path of supplementing protein, again, the purpose of this 4-week challenge is to focus on bringing in whole plant food nutrition. And so what we mean by that is first starting to see how you can shift some aspects of your diet to include more whole plant foods. So some of those plant protein sources are going to include things like legumes, which are beans, chickpeas, lentils. These are great sources of protein. They also happen to be fiber rich. Our nuts and our seeds, so things like chia seed, flaxseed, all different types of nuts as well. These are going to be great sources of plant proteins and healthy unsaturated fats as well. So I'd encourage you to first think about how you can begin to include more of these whole plant food nutrition components and shift your diet pattern to support more whole plant food nutrition. And then there may be an individual reason why someone might need to supplement with a protein powder, but I would encourage you to discuss that with your medical provider if that's something that you think you might need.
Did you want to touch on the soy as well?
Oh, in terms of soy foods, yeah, this is an area that's been largely sort of misunderstood. And when we think about soy foods, we're talking about minimally processed soy. So those are going to be things like tofu, tempeh, unsweetened soy milk, the edamame, which is the soybean, and miso, which is fermented soybean and often used in, for example, miso soup. So these are very minimally processed forms of soy. They're going to be health promoting for bone health, for women's health, for cardiovascular health as well. So I would encourage you to even seek out additional information, whether it's from one of our lifestyle medicine dietitians, if you have questions about whether soy is something that you can personally include, but the science around minimally processed soy shows that we can have great health effects from including these types of minimally processed soy in our diet on a regular basis.
Great. I think that's all of the time that we have for questions. But anybody whose question was not answered, we will do our best to answer those in the chat as well. And thank you so much, Dr. Artz, for opening us up. And hopefully everybody will continue to join us for the rest of the Plant Power Challenge.
Thanks, everybody. And I hope you're off to a great week for week 1 of the Plant Power Challenge. Take care.